Hi everybody, Dr. Sam Gaston here with North Texas Sport and Spine. In this September video series, I will be discussing a condition that I see often in practice, and that is sciatica. So, what is sciatica? It's nerve pain that results from an injury or irritation to the sciatic nerve. The National Institute of Health estimates that up to 40% of the population will experience sciatica at some point during their lifetime. So it's a condition that's worth understanding a little bit about. It can be a diagnosis on its own, but it's more often a symptom associated with another condition. So before we get too deep into sciatica, let's first talk about what is the sciatic nerve. It is the longest and largest nerve in the body. It forms in the low back from the L4 through S3 nerve roots, and then it leaves the spine, travels through the glute, down the hamstring, to the back of the knee. Right there it splits into the nerves that go down to your foot in the lower leg. The sciatic nerve is responsible for controlling all three of the hamstring muscles and the back part of the inner thigh here. It also branches off into those nerves behind the knee that then control the calf and the musculature of the lower leg and the foot. Now that you know what the sciatic nerve is, let's talk about the symptoms of sciatica. The most common symptom that people associate with sciatica is shooting pain down the back of the leg. This pain can feel like burning, electrical pain, shooting, sometimes numbness. It could be sharp. You could have all sorts of different symptoms associated with that sciatic nerve. The pain can also stop in the glutes, it can stop in the hamstring, it can stop in the calf, or with some people it goes all the way down to the bottom of the foot. Basically anywhere that the sciatic nerve or the nerves that branch off of it run to can be affected. In the past, I've had patients put that they've got sciatica on their new patient paperwork, and then when I do the history and talk with them, they are describing a pain in their shoulder or in their back. That can still be nerve pain, but it's definitely not sciatic pain because the sciatic nerve is down in the leg. People sometimes think that sciatica is just a pinched nerve that can then be unpinched, but that's not the case. Nerves have vasculature, so arteries and blood vessels, just like any other tissue in the body. And because of that, the nerve can be damaged and could get a bruise, which can sometimes result in sciatic pain. There are multiple other conditions that could cause sciatica, including piriformis syndrome, facet syndrome, various types of degeneration in the spine, and then bulging or herniated discs. I'll cover some of these conditions in next week's video, so be sure to be on the lookout for that so that you can continue along with me in this September of sciatica.